Good morning, class. So today we are going to learning about the vital signs of a child or an infant. Okay. So what are the basic vital signs we measure in an infant? What are the things? SpO2 and BP. So today we are gonna learn about the TPR chart, like temperature, pulse and respiration. Okay. So in an infant, to measure the TPR, we have to collect some articles to measure the temperature, pulse and respiration. Okay. Then we have collected a tray containing a stetho to measure the pulse and a thermometer to measure the temperature and a kidney dish to discard the cotton balls which is soaked in spirit, and a record book to record what are vital signs we have taken. Okay. So in infant, when we are gonna measure the vital signs, we have to prepare the patient, and then what are the next measurements or what are the preparations we are gonna take?
Environment preparation, safe preparation, and
Article preparation. Okay. Then in environment preparation, what are we gonna do?
light on, fan on, as per patient needs.
As per patient need. Okay. Then when we gonna start the procedure, we have to make the baby or the infant comfortable. Then when we are gonna take the measurements, we have to drape the baby in a comfortable position. At first, when we are gonna take the baby from the mother, then we have to explain the total procedure to the mother, that we are taking the child to measure his vitals, and then we will return the baby to the mother. So what's next? In temperature measurement, at first we are gonna take the thermometer and see it's working or not, and as you can see, this the reading is low, and as it is so seen that it's normal. So before it is putting under the axilla, we have to clean the thermometer, as it is used in various patients. So to maintain the sterility or the to prevent the cross infection, we have to sterile the probe and the thermometer first. So we are gonna take a spirit cotton soaked ball, and what's gonna do next? We have to start with the tip of the thermometer, and we are gonna take it like it's in round and round and round from the tip to the next part. Done, and we are gonna discard it in the kidney dish. Then we are gonna take a little bit of amount of the cotton ball and clear the axilla of the baby. Then we are gonna discard it in the kidney dish, and we are gonna put it in the baby's axilla. And while putting it in the axilla, we have to put the thermometer in the longitudinal position. So why it is given it's like that?
Because the child can hold it and very small.
Yes, and in case of it is a lead thermometer, so it is even when it is placed in longitudinal method, so the other environmental factors like the lights, air, it should not be affected the lead. So it is positioned as the longitudinal side. Okay. So then, as it is a digital thermometer, so the other environmental factors should not be affected this thermometer, so we can get the reading easily. So whenever this machine beeps, then we can get the proper reading of the temperature of the patient or the infant. Okay. So and after the getting the reading, we will record it in our notebook. Okay. Then next is the pulse or the heartbeat of the infant. So what are the positions we take the heartbeat or what are the positions of the pulse we have generally taken from in adult? In adult, but in case of infants, right? As because the apical pulse is much stronger than the radial pulse, so we generally take the apical pulse to measure the heartbeat or the pulse. Okay. So we are gonna clean the probe with a spirit cotton ball and then clean it and discard it into the kidney dish. And it is not before, it is used before, so we have to clean the ear probe also, and after cleaning this we will use this to measure the pulse. So after placing the ear probes in our ear, we will place the probe as the apex of the heart, and we will count it in a watch, and we will count it until up to 1 minute, right? We will see the seconds and we will count it up to 1 minute, then we will get the total pulse of a infant. Okay. And then what are the remaining parts we are gonna left? That's the respiration. So how are we gonna measure the respiration? Can anyone tell?
Shoulders of the baby and দুটো প্রসিডিউর আছে, একটা ডায়াফ্রামে হ্যান্ড প্লেস করে হতে পারে, একটা টু ফিঙ্গার শোল্ডারের উপর প্লেস করে 1 মিনিটে কাউন্ট।
Okay, you're right. So it is more easier to place a 2 finger on the Zippy sternum, so that we can see the ups and downs and feel the ups and downs of a patient or the infant's respiration. So, and we can place the hand on the chest and count up to 1 minute, and then we can get the respiration rate of the infant. Okay. Then we will see and record the pulse, respiration and temperature in our record book. Okay. And also we have to inform the nurse or whoever attending the patient that her vitals are normal or not, and also inform their mother that her vitals or his vitals is stable to her mother. Okay. Then next, how are we going to terminate the procedure? Okay.
Macular towels will be discarded in. First, we will wash it in running water,
Okay.
then running water, then we have to dry it in the shadow area, and then we have to spray some powder and roll it and
Place it in the inventory. And then what are the discard procedure of the cotton balls?
we have to discard it in the yellow bucket. It is contained.
Okay.
Yellow bucket can be used.
Yes, paper bag also can be used as it is not contaminated with any body fluid. Then what are about the utensils?
Steel and
Okay. Okay, that's good. So after the procedure, we will discard and terminate all the articles and give it back the baby to their mother. Okay. Thank you.